We are going to discuss today's Hindu newspaper. This will cover most important topics, editorials, and won't take more than 10 minutes of your time. Do not spend all your time on newspapers. Prioritize, read, and understand the most important topics. Vaccination lag in rural India points to a looming crisis. Only about 15% have been immunized outside urban areas. As you can see from the table, in April 2020, there were 10% cases in rural India and 51% was from urban areas. In May 2021, urban area has decreased to 13% and rural area contributes 35% of the disease. One of the reasons in the reduction of number of cases in urban areas is because of the doses administered per 100 persons in urban areas. As you can see, in April it was 25.5 per 100 persons, and in May it became 30.3 per 100 persons, while at the same time in rural areas it was only 10.9 and 12.7. So the number of doses, especially in rural areas, should be increased. Especially in case of third or fourth wave, without necessary health infrastructure, the rural areas will face a lot of problems if people are not vaccinated. So the government should take active measures to ensure that people in rural area also receive vaccination. Now we go to one of the editorial articles, Tracking the Pandemic's Rural March. Disease has spread this time to rural areas. In the first wave, rural areas were mostly spared. The disease was concentrated in urban areas, but this time around, disease has spread rapidly to rural areas too. So let's look at the numbers in Bihar. Compared to 10,337 functioning subcenters in rural Bihar in 2005, only 9,112 subcenters were functioning in 2020. The number of community health centers declined during the same period from 101 in 2005 to only 57 in 2020. Despite population growth, during the same period, the number of primary health centers increased marginally to 2,700 in 2020 compared to 1,648 in 2005. So even after 15 years, there is not much growth in the rural health infrastructures. In contrast, there is a reduction of health centers and sub-centers. Now we look at the numbers in UP. You can see the same trend here. The number of primary health centers declining from 3,660 in 2005 to 2,880 in 2020. While the number of community health centers increased from 386 to 711, during the same period, sub-centers increased only marginally from 2,521 in 2005 to 20,778 in 2020. The situation with regard to the availability of health professionals is not very different, with most states witnessing a worsening situation. For example, only 29% of specialists were in place in the community health centers in Uttar Pradesh as against a requirement based on official norms. Even though you don't have to remember the exact numbers, an idea about the different figures will be useful when you are writing an essay. Even though these numbers were in front of the state and central governments, they did not act to stop avoidable events like long duration elections, religious gatherings, election rallies, and so on. The last 2 points from this editorial is judiciary stepping in. For example, Allahabad Court advising for different containment measures, Supreme Court asking restraint from UP government from taking cases against patients asking for help. The editorial concludes by saying that apart from the disease, rural population also have lost job and income, pushing them to debts from private money lenders, and without the support of the government, it is very hard for them to survive. Next article is Delete and Control. The Indian Council of Medical Research (ICMR) must assess evidence and be very specific with recommendations on treatment. ICMR has finally dropped its recommendation of convalescent plasma therapy (CPT) as treatment for the pandemic in its latest guidelines. So basically, CPT was a part of the official ICMR guideline for treatment but has been dropped only recently. Clinical trials last year demonstrated that CPT neither saved lives nor improved patient outcomes. Let's look at what CPT is. Basically, it is taking blood from a person who has recovered from an infectious disease and using that blood to treat new patients. The blood contains plasma, blood cells, platelets, and from this donated blood, we remove the blood cells and leaving behind the liquid plasma which contains the antibodies. When it is introduced to a patient, the antibodies will help that person to fight the disease better. But for current pandemic situation, CPT has not saved lives nor improved patient outcomes, so it has been dropped. Stormy start. Last year, the Indian Meteorological Department (IMD) launched an impact-based cyclone warning system from the October to December season. It is designed to reduce economic losses by focusing on districts and specific locations and considering factors such as population, infrastructure, land use, and settlements. It is very important to have precise early warnings considering that the Arabian Sea has emerged as a major source of severe cyclones. If you look at past 2 years, you can see a number of cyclones originating from the Arabian Sea, and the intensity has also been aggravated by long-term rise in sea surface temperatures linked to pollution over South Asia and its neighborhood. So one of the major reasons is the increase in global temperature, basically the climate change that has increased the number of cyclones in the Indian Ocean. Last point is climate proofing lives and dwellings is a high priority. Build sturdy homes of suitable design, create adequate storm shelters, provide accurate early warnings, and ensure financial protection against calamities through insurance for property and assets. Cyclone classification. The recent cyclone Tauktae belonged to very severe cyclonic storm because its speed touched about 190 km per hour. As you can see, the cyclone classification is based on the wind speeds. Low pressure area less than 31 km per hour, depression 31 to 49, deep depression 50 to 61, and so on. At some point, Tauktae was classified as very severe cyclonic storm, but it reduced in severity after landfall. You might think why the severity of a cyclone reduces during landfall. It is because to sustain a cyclone, it needs the moisture absorbed from the ocean surface. Once it reaches the land, the moisture input is gone and hence the cyclone becomes weaker and weaker. Now looking at the next article, planning for future waves of the pandemic. There are 3 points. The first point is surveillance. Underreporting and manipulated data inputs can only provide faulty projections. So the governments, center and state should avoid such manipulations at all costs. There will be multiple waves in India. Even in Japan, the health system is under a lot of stress during the 4th wave. Proper surveillance of the disease and containment from spreading to other places is the first step. Second is vaccinating the population. The central government should proactively reach out to all the vaccine manufacturing firms in the West and invite them to collaborate with Indian firms. India needs to fast-track the manufacturing of all vaccines which have been approved for use by various regulatory authorities around the world through a single window clearance. Since it has already been given approval in other countries, India should fast-track the process and introduce as many vaccines as possible to the Indian market. Vaccines might be the shot in the arm for our economy. So basically it means that even if we spend a lot of money for vaccination during this stage, it will help us ultimately because then our economy can open up again. Many of the states, districts are currently under lockdown, which means reduced incomes. If through vaccinations we are able to completely open up India by the end of 2021, then that will help our economy a lot. Last point is nearly 60% of non-infectious diseases and up to 75% of new or emerging infectious diseases are zoonotic in origin. So zoonotic means emerged from animal, like the emergence of Nipah virus in Kerala in 2018. It was transferred from bats to human beings. So government should ensure that environmental health and animal health are given similar priority as human health. There are a lot of interactions between humans and animals and it needs to be healthy, and to prevent any further disease transmission, the health of the animal population should also be taken care of. Now we come to the third point, robust public health workforce. Apart from infrastructure, doctors and nurses have to bear the burden mainly because of a depleted or absent public health workforce. The number of health personnel should be increased. For example, even if you increase the number of ambulances, you need expert drivers, you need people who are able to give the initial health support to the patients that is transferred using the ambulance. So some of the recommendations given in the article are: ensure that one accredited social health activist, ASHA worker is hired for every 1,000 people. An auxiliary nurse midwife and nurse practitioner are hired for every 5,000 people. And a hospital with at least 100 beds, including beds with emergency and critical care services, caters to a population of 30,000 to 50,000. Now we come to vocabulary section. First word is burgeoning, which means beginning to grow or increase rapidly. Second word, exacerbation, an increase in the severity of a disease, or it also means worsening. Next word is clamor, a loud and confused noise, especially that of people shouting. Next word is equipoise, meaning balance of forces or interests. Espousal, an act of supporting a cause, belief, or way of life. The last word is impetus, which means a driving force. I hope this video was useful. You can attend the Hindu quiz by clicking on the link given below. If the video was useful, consider subscribing to this channel and sharing it to others. Stay safe and see you again.